and welcome to SCAN. SCAN is the Social Communities Activities Network, a nonprofit agency that is dedicated to helping active adults stay informed, empowered, and inspired. I'm your host, Tracy Wolfman, and I am the CEO of We Care Adult Care in Middletown, New Jersey, and the Vice President on the board of SCAN here. Our expert guests offer insight and valuable information along with the resources that you may be interested in. SCAN offers an array of classes that will keep you inspired and hopefully empowered during your stay here. I'd like to welcome my guest today, Mary Nicosia, an advanced practice nurse, and Dr. Timothy Sullivan of the Parker Family Health Center. Welcome to the show today.
Hi, thanks for inviting us.
Coming.
Thank you.
I just want to let our guests know before we start a little background on Mary and Dr. Sullivan. So Mary Nicosia is the clinical director. She has a BSN from Fairleigh Dickinson University and a master's degree in nursing administration from NYU. She has certification as a family nurse practitioner from Arizona State University. Included in her nursing experience is neurosurgical operating room manager at Memorial Sloan Kettering in New York City. Before coming to the Parker Family Health Center, Mary served as the clinical director and direct care provider at the Escalante Health Clinic in Tempe, Arizona, an affiliate of Arizona State University. She has overseen the Parker Family Health Center since it was founded in 2000. Boy, from the inception to here. Wonderful. Dr. Sullivan, our other guest, and Dr. Eugene Cheslock were the co-founders of the Parker Family Health Center in 2000 and continue to serve on its board of directors. Dr. Sullivan began his practice of ears, nose, and throat medicine and surgery in 1977. He served as Riverview Medical Center's medical staff president from 1997 to 98 and Riverview's vice president of medical affairs from 1999 to 2002. Prior to retiring, he was employed as the medical director for Horizon Blue Cross Blue Shield and United Healthcare. He continues to volunteer as a physician at the Parker Family Health Center, as well as part of a medical mission to Guatemala. Dr. Sullivan serves on the Little Silver Board of Health and the Monmouth County Regional Health Commission. So we have two fabulous guests here today. I mean, that's long, extensive experience. So I bet you're tired and still trucking, right?
Yeah, we're related.
So the Parker Family Health Clinic, I know it's in Red Bank, so why don't you just tell us the location of where it is?
It's 211 Shrewsbury Avenue in Red Bank.
Okay.
On a bus route.
On
On a bus route.
Oh, very
Close to a
good.
station. And it's on that side, and the health center got its name from Dr. James Parker. Dr. Parker was a prominent member of the West Side community.
Okay.
He provided care, and one of the unique things about Jim is he understood that for the working person on an hourly wage, it wasn't just the cost of going to see the doctor, but it was also how much he was going to lose by having to take time off from work. Jim would see patients early in the morning, opening his office at 5 o'clock in the morning, and then again opening late in the afternoon and staying until 7 or 8 o'clock at night. Jim also took care of patients regardless of their ability to pay. Dr. Cheslock approached me in 1998 concerned that Jim was getting older, what was going to happen to his patients when Jim was no longer able to practice.
Right.
And asked me if I'd be interested in opening up a free clinic. About 2 weeks prior to that, I had given a lecture on mission trips to Guatemala, and a student said, if you can do that in Guatemala, why can't you do it here in the States?
You had mentioned that to me earlier, and I just think what insight that kid had.
Yes. And we decided that we would take care of the uninsured because at that time there were other physicians on the west side of Red Bank that would accept Medicare, Medicaid. We didn't want to be in competition with them. But we also knew that there was an uninsured segment that couldn't afford health care, and that's where we wanted to focus. Also, if we accepted Medicare and Medicaid, I don't think we could get people to donate because then you'd be donating to a business.
Correct.
If it's a volunteer organization, and just taking care of the uninsured,
Right.
we thought it would be better for fundraising purposes.
So you're on the west side of Red Bank, and it's called the James Parker Boulevard, isn't it? Or
Bergen Place. We were on
Shrewsbury
Shrewsbury, but yes,
Okay,
that
so
street was
the
named after
doctor-
Jim. Yes. Yeah.
So
And-
that's a wonderful attribute to him, and
It sure
all
is.
everything that evolved because of the.
So
When-
his father was also a physician.
Right.
Oh, he
Dr.
was.
Parker
Right.
Sr., so really is a tribute to both Dr. Parker Jr. and Dr. Parker Sr.
That is.
Jim was a little reluctant for the praise that he would get for everything
So he
that
was
he
a
did.
humble man.
He was a
That's why
humble
he's so
man.
successful.
And we, while I was president of the medical staff, we also started the medical staff, started a scholarship fund at Red Bank Regional for
Okay.
a promising student. And we named it the Jim Parker, Dr. Parker Scholarship. And I get a call from Dr. Parker, and he says, "You know, Tim, I'm not dead yet." I said, "Jim, it's okay for people to say nice things about you while you're still alive,
Right,
rather than
right,
visiting
right.
the gravesite." So that was '98. We, Dr. Cheslock had been raising funds for American Cancer Society. He had a great personality for that. It was a perfect match. So he did a lot of the fundraising, looking for donations, and I was associated with Riverview, and Riverview has been our partner from the very beginning.
So when this idea first evolved, I'm sure
Right.
you were sitting at a restaurant table or a kitchen table, because that's how all these things evolve. Yes.
Sure.
Did you really think it was going to take off and be what it became?
His own
I knew-
I mean, we're going to go through all that.
I knew that we were certainly going to give it a try.
go.
And, you know, if you don't try, you're never going to succeed.
Right. Now, here's the next question. Were you surprised at the generosity of people when you started fundraising, or did you have to convince them?
I think there was some convincing. There were several outreaches. We had to outreach to the community leaders. We wanted the community to buy in to what we were
gonna
doing.
do.
Also needed people to buy in financially, and that was really, Gene, again, was the perfect person, perfect personality to get that buy-in.
Okay.
We had several meetings with religious leaders from the west side of town, community leaders. Lunch break had started. Actually, some of our earlier meetings were at lunch break. They
Okay.
offered that room to us. But it really took a few years of effort just to get this thing off the ground.
I'm sure.
Dr. Cheslock was able to get property from the, it's a senior,
The old River Street School became a senior center.
Yes.
And he was able to get the property for our trailer for $1 for the property. And then we were able to get a trailer from the Paddock Company. And we brought it down to that
Paddock
property.
Construction.
Right.
Paddock Construction, J. Paddock. We brought it down to that area.
now a trailer, this is a cargo trailer.
Yeah, it was
Okay.
empty. It was a shell.
It was a shell.
And Riverview Hospital outfitted the whole thing for us. And when you walked inside that trailer, it looked like a doctor's office. It was really beautiful. It was really nice.
That part of it I did not know. Now, on one of your questions, then you got bigger leaders in the community, and the Bon Jovi family
Right.
jumped in.
Well, just to tell
Talk
you,
about Red Bank and how
yeah,
everything-
the Red Bank Zoning Board,
Oh,
in terms of doubt,
right.
for all of the positive ideas that we had that this was going to work, enough people told us that it wasn't going to work that I told Gene, as soon as we see our first patient, we've been a success, because so many people said we were going to fail, and then it was just going to be a question of how successful we could be. When we went for approval from the Red Bank Zoning Board, there was a member of the board who was very reluctant to say yes, but he finally said, what the hell, if they fail, they can just hook up the trailer and tow it out of there.
Wow. That's
So-
negative.
Well, you know, it was a novel idea for our
Right.
area. You know, we don't live in a poor area in Monmouth County. This
You're
is a very
absolutely
wealthy
correct.
area. And in 2000, a lot of people had health care, except for some very poor areas in some towns.
Right.
So it took a little convincing. But like Dr. Sullivan said, after our first night, we knew we were a success. And it's been
And-
gangbusters
Right.
ever since.
For 19, going on 20
Right.
years now.
And after we opened, and we started to see patients,
Right.
people who were friends of Dorothea Bon Jovi heard about what we were doing, brought Dorothea over to the trailer.
Oh,
So,
best way to showcase it, right?
And the best way to get your husband involved is convince your wife that it's a good idea.
That's correct.
So the proposal was that John would do a fundraiser for us, but he required 3 things. We had to have clear title to the land,
Okay.
we had to have a design for the clinic, and we had to have a scale model, and it couldn't just be a square wooden box, it had to be an inspirational building.
Interesting.
Ed O'Neill from Some Architecture was also teaching at Brookdale, and he made the design of the clinic one of his term projects. So students came over to the trailer, questioned us about what we were hoping for, what we were
What an
needing.
experience for those students.
So some of their ideas are all incorporated into what the clinic looks like today.
That is fabulous.
The other stroke collection, so we had those 3 things. John Bon Jovi volunteered to do a fundraiser for us. And John was on tour, and so the fundraiser would either have to be in the spring or the fall, because he wanted to be at home for his kids' birthdays. So it was put out we could either do the spring or the fall of 2001. We opted for the spring of 2001. If we had opted for the later date, that would have been after 9/11.
Oh, and everything probably.
So I
worked
think
out.
a lot of the financial support that we got having it in the spring of 2001 might have gone in other directions had we postponed it to the fall.
So that's how that evolved with the Bon Jovis.
Right.
I mean, that was a nice dedication that they did for you.
Yes.
And that fundraiser was obviously successful.
Very successful. We bought our
And
new building.
Bought your new building
Yes.
and also exposed it to the whole community and what you
Yes.
were,
Right.
your dream of doing healthcare for those that were uninsured.
It was unique in this area. There were other, we modeled some of what we do after volunteers in medicine. It was a group of retired physicians in Hilton Head, South Carolina, who realized that there were more retired physicians on Hilton Head than in the surrounding counties. So they opened up a free clinic down there. And a lot of the basic framework of how we structured ourselves came from the volunteers in medicine.
Now, did you get a lot of assistance from other physicians once you started your idea? Were they willing
Yes.
to jump in?
Yes.
I mean, I
Riverview
do remember
Hospital.
in the early days of just reading about it in the paper that
Right.
people were volunteering,
Yes, we got the majority of our beginning physician practitioners from Riverview Hospital, and also our nurses as well.
that is really,
Dr.
you know,
Cheslock presented me with a list of doctors and nurses to call, so I did, and we most of our
Right.
volunteers were from Riverview at that time.
so when we come back from, because we're going to go to a short break in a minute, but when we come back, then you can explain really what the role is and what kind
Okay.
of people that you're starting
Sure.
to see now. I'm sure you go 5 days a week or 7 days a week?
6 days a week.
6 days a week. Okay.
Saturdays are a half day.
Saturday's a half day, so I'm sure that's accommodating for people that have to go to
Sure.
work, and you're probably
And
very busy.
Later on Mondays and Wednesdays, yes, and we can let you know all that.
Okay, very
All
good.
right.
So we're going to take a short break here at Welcome to Scan. Stay with us. We're going to return after these messages. We're here with Dr. Timothy Sullivan and Mary Nicosia, nurse practitioner from the Parker Family Health Center. Stay tuned, and we will be back.
So, if you're over 65, like me,
and active and fairly healthy,
Being active and healthy alone will not protect you.
Remember, the immune system weakens with age.
And if you're over 65, ask your doctor about your vaccination options.
We want you to be healthy and active.
Welcome back to Welcome to Scan. My guests today here are Mary Nicosia, Clinical Director of the Parker Family Health Center, and Dr. Timothy Sullivan, who's the co-founder of the Parker Family Health Center. A mouthful. Anyway, thank you again for being on the show today.
Thank you.
Learning so much about what's going on and things that we never knew about, and I hope that our viewers today get to go visit the Parker Family Health Center and see what they have to offer. So your typical patient, sometimes I get mixed up with patients, clients.
Yeah, we see adults and children.
Okay.
And our children's wellness program consists of an annual physical, dental referral, vaccines for children.
And you do all that on site?
All that on site, yes. We get vaccines from the state of New Jersey for both adults and children. And if we have specialists, if the children require specialists, we try to seek them out. We go as far as St. Peter's, Jersey Shore for specialists for kids. We have an adult program as well for wellness and chronic disease. Okay. So our adult patients can come and get vaccines. They can get physicals for work or to go to school. Get them back in the employment world.
Right.
And also we have a wonderful chronic disease program. We have over 250 diabetic patients. We have a full service diabetic program. We provide a nurse practitioner who sees them. About 90% of our diabetics are seen by our nurse practitioner.
From children through adults?
Yes, we don't have many childhood diabetics. We have mostly adult diabetics. We have an endocrinologist that can see our diabetics, a podiatrist. We have about 8 specialists also that can see our adults as well.
So you told me previously about 40 physicians on staff. So when you go to the clinic, you're getting the best of the best because all of these doctors are practicing.
We think they're the best of the best, absolutely.
Right.
We have generalists, internal medicine doctors, and we have specialists. We also have specialists that we can send our patients to in their private offices. But we have a whole gamut. We have cardiologists, rheumatologists, podiatry, nephrology, neurology,
So
right
they-
at the Parker Clinic.
So they can have all of their needs met
They
without
can.
having to worry that if
They
I go to
can.
the clinic and I need a specialist, I won't get that care.
Correct.
So, I mean, that's really...
It's awesome.
It is. I don't know if we had mentioned enough that the Parker Family Health, it's for people that are uninsured.
The
Correct.
criteria
So-
to come to the Parker Clinic is they have to live in Monmouth County.
Okay.
And that goes all the way from, the ocean to Allentown, and up to, down to Point Pleasant, up to what the north would be, Union Beach. And they have to have fall below 300% of the poverty level.
Okay.
So those are the 2 criteria, and not have insurance, of course.
So if they didn't have insurance and they wanted to come, and is there a copay sliding scale
There's
system?
nothing. We don't accept any money.
Okay.
And we can't because we have immunity or malpractice from the Federal Tort Claims Act for our providers, all of
Okay.
our medical practitioners.
And that allows us to have physicians that are retiring
Okay.
to come and provide care, because malpractice insurance can be
Owners.
onerous if they're not
If they're not
engaged in
practicing.
active practice.
We also have a wonderful pharmacy assistance program for brand medications for many of the diabetics take advantage of. Insulin is so very expensive, and
It
many of the
is.
newer drugs which are used to treat diabetes are really, really difficult to get on your own. So our pharmacy assistance program allows those drugs to come to us, which we give out to the patients for free.
So
Yeah.
they can get all their medications from you also?
No, not
No.
all of them, just
Oh,
the brand
okay.
medications. Nowadays, you can go to the drugstore and get $3.99 for 30, $9.99. It's a
Correct.
lot. It's actually a lot better than it was 20 years ago when we first opened.
when
we
we
were paying for a lot of the medications.
Right.
Very expensive.
And then we had a
Contract with 3
with 3
pharmacies then.
Right.
Katzens, Red Bank Professional, and the pharmacy that had been in Foodtown.
Foodtown.
And with negotiating, we were able to get them to fill contracts at what their acquisition cost of the drug was, plus $1 for administrative fees.
Okay.
So medications aren't so much of an issue now, and we do have a special medication fund for patients that can't afford their medications.
Through donations, I'm going to
Yes,
assume.
we do.
Because it's fruitless to prescribe, to diagnose a condition if you
Yes.
can't afford the medicine to fix it.
Correct.
So it's always been part of what we've intended to
We
do.
want the patients to leave feeling better,
We-
certainly.
So
We-
you're making sure that somehow they're getting the medication, whether it's through your donation fund of medication paying or from the pharmacies.
And
Yes.
some of the studies that we've done, some of our diabetic patients we can show are better controlled than some of
Oh,
the
I'm sure they
Medicare
do.
and Medicare programs in
private
this
insurance.
in the
Because
state.
you're educating them, you're overseeing their care.
We have a nutritionist.
And they know that they're coming to us for their care. They're not coming to a business, so they know that we're there really just to take care of them.
One of the important programs we have also is we have a social worker at the clinic who meets all the new patients, and she does an assessment. So if there are problems they're having that aren't health related, like the patients that can't get their transportation problems or don't have any money for food, or all those social determinants that
So she helps them with that?
Yes, that get in the way of them getting their better care anywhere. She helps them with that, and I don't know how we did it without a social worker for 10 years, but she is just wonderful, and so it makes it more of a holistic offering for us.
I know in our business also, the social worker is the key to
Yes.
getting everyone their
You can't
services.
separate the mind and the body and the social that's going on with the patient. When it
Because
comes to
there's a
health.
whole bigger picture
Absolutely.
out there, and I don't think a lot of times people realize you're trying to fix their health care needs, but what's going on at home?
Exactly.
And that social worker has the ability to do that, so that's a great thing.
Exactly.
What are some of the challenges that you face at the Parker Family Health Center right now?
Well, being a nonprofit, it's always funding.
Correct.
And for us specifically, it's providers always having more doctors, more nurse practitioners, more nurses. We use interpreters for many of our clinics.
Oh, I'm sure
And
that.
we need administrative people too, because we are, we try to run on a very low budget. It's hard sometimes because it's healthcare. We have to.
And healthcare is
But I guess it's really
astronomical.
funding
Right.
and providers.
I mean, for all of the volunteers that we have, you also, in a medical practice, need some consistency for record keeping and everything.
Absolutely.
So we do have a staff that's paid,
Yes.
and fundraising is always an ongoing problem. And one of the things in the beginning, because we were unique, we had newspaper exposure, we had TV exposure,
Right.
and that has kind of died off a little bit. Also, a lot of the people who were our donors in the very beginning, they may have passed on, and maybe their families have different, humanitarian interests. So we're always looking for new donors. Most of our funding comes from donations. We also apply for grants.
Grants, foundations. We have a development director. She's new with us in the past 2 years. She's done a wonderful job. There are a lot of generous people in the area. Dr. Cheslock brought with him a lot of people, but we're always still looking because there are a lot of nonprofits in Monmouth County, and we do try to collaborate and meet all of them so we aren't
Right.
redundant,
Well, there's nobody else doing the service and providing the services that you provide. And
Yes.
are there any clinics like this in the state of New Jersey other than?
There are
Yes.
3 other ones.
Oh, there are.
Yes, there's one in Bergen County, Cape May County, and Camden. One of our programs that I didn't mention is our women's health program. We get money through the Cancer Education Early Detection Program to send our patients to the VNA for their wellness, and that is a wonderful coordinated group effort that we have with the VNA. We also have a genetic testing program for
Wow.
breast cancer through the Christine Meredith Mealy Foundation. So we're able to assess our patients for breast cancer through a genetic program.
Right.
So I didn't want to not
Right.
mention the
Oh.
women's
Yeah,
program.
and that's a very important
Yes,
one that
it
a lot
is.
of people don't get the opportunities to have
Very
genetic
important.
testing.
And we continue to have our working relationship with Riverview Medical Center.
Oh, yes.
They do our lab work for us.
Okay.
We can refer patients that need emergency care to their emergency room. But it's better for us and probably less costly for the hospital if we can see people early on in their disease, control their disease, prevent it from progressing. We'd rather take care of a diabetic in the clinic, keep them out of the emergency room,
Right.
take care of that patient who may be headed for obesity and heart problems.
NMI and amputation, blindness, all those things that diabetes
That
leads
go along and
to.
that
Right.
people don't understand.
Right.
I was going to ask you a question about that. What about sending them to the hospital? Since some of yours are uninsured, do they have the ability to go to?
Absolutely. The hospital accepts them in the emergency room, absolutely, no question.
Right.
And then we have very good communication with the emergency room and the inpatient area as well. So when those patients are discharged, we get all their notes, we talk to the doctors,
So the continuity
Oh,
of
the
care
continuity
is
and the
absolutely-
transfer of
Right.
care is 100%.
And actually, some patients who go into the ER, if
Right.
they're uninsured and have not been involved with us before, the emergency room will send them to us for their after discharge care,
Oh,
rather than
okay,
just
so
saying
then
go
you
find
collect-
somebody.
Transitions of care are very important in medicine.
Absolutely. How many approximately registered patients do you have
Right
in
now,
a year or right now?
in our, we always do 3 years because we keep those, we're a paper charts, about 3,000, about 3,500.
Who otherwise, so when we talk to our audience, about 3,000 people that otherwise would not have the opportunity to have any kind of care, never mind quality of
Right.
care.
Mary, when we opened in the administrative area, there was a wall of empty shelves for medical records. And Mary said, look at all of those empty shelves. And I said, look, the shelves are there, we're going to fill them.
Yeah, we're going to film.
So now those shelves are filled with just our
3 years worth.
3
and the
years
rest
worth
are
of
in the
patients.
basement
Everybody
waiting.
else is in the
So it's
basement.
completely full. So what do they
Completely
say?
full.
Build it and they will come.
Come. Yes.
Exactly. We've seen over about 150,000 visits since we opened.
That is unbelievable.
Yeah, we're very busy.
Now, just through this conversation, I think that you need to get a volunteer social media person to
Yes.
expose
Yes.
everything, because
yes, that would be
that's
for
what
free.
everyone. No, a volunteer. I
Right.
just said.
Oh, yes.
Because and there's so many people out there, because I think the more exposure. And all the good things that you're doing really need to be
Yes.
consistently reminded to people.
Absolutely.
And we're hoping that next year, with it 2020 being our 20th anniversary, it will give us an opportunity
For exposure.
to get some exposure in the media.
And not
Yeah.
just for donors, but for patients too. I know there's patients out there that need to see a doctor. They may not think they do,
Right.
but they need to come in and be, have some diagnostic testing, talk about their lifestyle, health
Right.
prevention and health promotion and disease prevention. That's what we want to focus on.
So important. And people, sometimes they're afraid to make that initial call or that initial step towards getting some help, and they wait until there's a crisis.
And many businesses require a pre-employment physical. So we can provide that physical for somebody who is uninsured so that they can get
A job.
and maybe even get benefits through that
I
job.
mean, that is invaluable in itself when you think about
Right.
all the people who aren't able to get a job because of the fact that they can't get a physical.
Sure.
Because physicals cost
Or
money.
they
Right.
sick and they can't get better, or they don't
Right.
think they can get better, and they
You know-
can't get the medications, and it's,
And I'm involved with the Health Commission, and they offer vaccinations also. But again, for some of our patients in Red Bank, Long Branch, transportation is an issue.
Right.
So that's why we kind of stay focused where we are.
I mean, all of these services, I hope today our viewers that are watching us can check out the Parker Family Health Center, whether you want to volunteer, whether you want to become a donor, or just get some information and help somebody who may not have insurance. I want to thank you so much for tuning in to Welcome to SCAN. I hope that you enjoyed and learned something helpful today. It's your turn. We'd love to hear from you and see what's on your mind. Call SCAN today at 732-542-1326. Send us your show ideas and feedback. And again, thank you for watching our Welcome to SCAN today. We're here with the Parker Family Health Center. Thank you.